Negative K, nothing further.
Today in America, if you or your loved one require a critical essential medicine after calling 911 and having that ambulance arrive or even going to the hospital, there's no guarantee that it will actually be available. In fact, each year, hundreds of drugs in our country go into shortage. We have a complex systemic problem associated with how our medicines get developed, made, and distributed to patients that has become an acceptable status quo. This status quo has three dangerous fronts: a broken pharmaceutical supply chain, outdated development and manufacturing practices, and a market that is failing economically, especially for critical, essential generic medicines. More than 80% of our active pharmaceutical ingredients, that critical component for all of our medicines in America, are manufactured on foreign soil, primarily in India and China, which has made our nation vulnerable to disruptions, whether from geopolitical conflict, natural disasters, or that next public health emergency. When medicines are developed and manufacturing using half-century-old status quo approaches, companies are leveraging antiquated chemistry, manufacturing techniques that are outdated, that are slow, they're inefficient, they're wasteful, coming at a high cost to our environment. Medicine manufacturing, including our essential medicine industrial base, has been driven offshore primarily due to low labor costs, loose environmental regulations, creating this unsustainable model filled with price spikes, unpredictability of supply that's impacting our most vulnerable patient populations, including pediatrics and the elderly. Phlow is the modern medicine manufacturer. And as a certified B Corporation, we believe the status quo must change now. We have inserted ourselves in the middle of this large-scale systemic issue with a visionary plan to move our industry forward to a new standard. We believe in achieving pharmaceutical sovereignty for the United States, leveraging advanced chemistry and manufacturing processes that will improve the quality and availability of the supply of medicines right here at home, leading the way to a future where medicine is safe and fully accessible. And alongside our mission, we are honored to steward the health of both people and our planet. Disrupting the status quo, it isn't easy. But in just 4 short years, we have built the nation's first advanced manufacturing essential medicine program in partnership with the United States government. We've innovated and developed a contract development and manufacturing organization that is unlike any in our nation. And we've built a leading coalition of health systems and hospitals that are driving forward a new generation of pediatric drug products that were previously left behind. At Phlow, we will not stop until we ensure that every person has access to the critical essential medicines necessary to sustain life and conquer disease.